Okay, guys. So the next test is you're moving into positioning. So we will be doing the Dix-Hallpike Maneuver to start. So this is how you want the participant to be set up. They're sitting upright and feet are at the end of the table, and then there's this pillow by their tailbone so that when you lean back, their head is you're exciting the posterior canal of whatever side you're testing. So before you do Dix-Hallpike, you perform the vertebral artery screening. So that is something like this. I want you to go ahead and turn your head over your right shoulder and look up at my finger for me. And then as they're looking, you might want their head to be a little bit more like that. And so you just want to strain the opposite side. Do you feel dizzy?
No.
Lightheaded?
No.
Any tingling?
No.
Your heart racing?
No.
Or you can go ahead and relax. What day of the week is it?
Tuesday.
Tuesday, great. And so then you would go ahead and repeat that on the other side. So then for Dix-Hallpike, you want to instruct before you start it. So during this test, I'll be supporting you the entire time. What's going to happen is on the count of 3, we're going to lean back. Don't worry, like I said, I'll be supporting you the whole time. You won't fall off, your head won't hit the table or anything like that. Your job is to just go ahead and keep your eyes nice and wide open. I'm going to be staring into them to see if I see anything. Just go ahead and keep them nice and wide and let me know at any point if you feel dizzy. Do you have any questions? Great. So then you can go ahead and support them in any way you want. This is how I like to do it. So you want their head to be turned kind of over their right shoulder and just really supporting their neck and head back here. And then the other thing is you need to remember to support yourself. So you can either pull up a chair so that when you sit, you're lying down, or you can just do some really good lateral lunges and make sure you're supporting your back, which is what I'm going to do right now. But before we do that, we want to go ahead and start the test. So it's fine for the test to be going
counting down from 1
as you're lying the patient back. So on the count of 3, 1, 2, 3, I take a big step, and now I'm not hunching over her like this. I'm supporting my back, and we're just going to go ahead and keep those eyes nice and wide, and you keep them in this position for about 30 seconds unless you see an nystagmus. How are you feeling?
Good.
Dizzy?
No.
Great. You're doing wonderful. I'm not going to keep her down for the full 30 seconds, but once you've reached 30 seconds, we're going to go ahead and sit up on the count of 3. 1, 2, 3. And keep their head in this position. And then you can be done. And then you do the other side.